Hi, everyone, and welcome to today's webinar here at VentureJect. So happy to see so many signed up. Over 200 have signed up for today's webinar, and it's always interesting to hear where you are listening in from or joining us from. So if you can, please do share in the comment section below what country or city you are in. Today's topic is health checks. What are they and why? Good for both business and employees. We bring up this topic in the light of preventive healthcare being of increasing importance. In the 21st century, our lifestyle have become more sedentary than generations before us. And this combined with both demographics that are rapidly aging and the rise in lifestyle disease such as diabetes, hypertension, heart disease, make for a reality that is threatening to overwhelm healthcare systems and really put pressure on the care that can be provided. In this picture, preventive healthcare is an effective measure that can help avoid or postpone the onset of various diseases. And to achieve this, health checks can be a good tool to bring and help awareness to an individual about his or her health risks or possible suggestions for lifestyle changes before consequences of a sedentary or unhealthy lifestyle manifests. To dive deeper into this, we have invited medical doctor Hanna-Lilja Olgidostir to share her perspectives as a healthcare professional. So I welcome live from Reykjavik, Dr. Olgidostir. Thank you for joining us today.
Hi, Peter. Thank you. It's a pleasure to be here, live from Reykjavik.
Thank you for taking the time out of your busy calendar to join us. And to all our viewers out there who haven't met you yet, perhaps you can just briefly introduce yourself.
Yes, thank you. So my name is Hanna-Lilja, and I'm a medical doctor in Iceland, but lived for 11 years in Copenhagen. But I did a specialist training in obstetrics and gynecology, and I work as a menopause specialist here in Iceland. I run the first menopause clinic here, Gina Medica. So I work a lot with women in midlife, where, like you talked about, many chronic diseases start to present in women at that point. So it's a great pleasure to be here with you today.
Thank you, Hanna, and good to hear that you also have been to Copenhagen, where VentureJect here is also based.
Exactly.
Just to open today's webinar, let's start from the very basics and from the headline of today's webinar. As a medical doctor, why do you see that it can be a good idea to have a regular health check done?
Well, as you mentioned in your introduction, the population is getting older and older, and as the lifespan is increasing, we still have the health span is not increasing accordingly. So we have a lot of older sick people in our population, and that's something that we need to work on. And the healthcare system today is often more focused on sick care than health care. So I think it's very important for us to change that narrative and raise more health awareness and put more focus on preventative care, because a lot of chronic diseases are preventable, or at least you can postpone it, because there's a lot of changes you can make in your lifestyle to postpone the development of these diseases. So it's very important for people to just be aware of their risk factors which can be family history or something else. And and then you can, prevent that you get chronic disease, and which can have influence on your work and your quality of life, and also just the healthcare system and the community as a whole.
Yeah. Yeah, so what you're saying is it's both a question about the individual, but it's also a question about the wider society. So we're really focusing on both areas here.
Yeah, definitely. Because if a large proportion of the population is sick and not giving something back to the community, then we have a big problem, and the healthcare system can't manage all of that. So we need to get this early intervention and and change the narrative there, definitely. And we do that not just, the individual needs to be more like an active participant in their own health journey, but not just a passive passenger and just, only coming to the doctor when there is a problem. It's important for them to be aware and and be ready before something bad happens.
Yeah, that's. I think you as a medical doctor know it better than anyone that from what I see is that people only go to the doctor once they are sick and need treatment, but not before.
Yeah, exactly. It has been like that, and also in the past, it was always like the doctor was the only one who knew best, and people just came to the doctor and doctor fixed me, and everything is just fixed with a pill. But now we know that we don't always need a pill. There's a lot of things you can do yourself if you are aware and take responsibility for your own health. So yes, definitely.
Mm. That also in this modern lifestyle, where we all work really hard, and people work more hours in the 21st century than they have done previously. And but work now is also more. Yeah, we're both seated right now, right? It's more sedentary.
Yeah.
What role do you see that the workplace plays in this?
The workplace has a huge responsibility there to like promote more breaks, to stand up, because yes, sedentary lifestyle does negatively influence the health outcomes. So by implementing some daily routine, promote some breaks where you can stand up and move, or give the employees a possibility, for example, to go to the gym in the lunchtime or something like that. It is a huge responsibility, because we spend a lot of our day at work, and if we sit all day long, 8-10 hours, then it definitely affects our health outcomes.
Yeah, it's. I think it's. I think we all feel that somehow, but when it comes from a medical professional who is faced with this now that you work primarily with women, though, but when you work with people who are feeling the onset of various consequences of a lifestyle, then it just perhaps adds a little more substance to the debate about this.
Definitely, and also mental health is also a huge part in here. And when you are at work and you sit inside the whole day, you're not moving, you're not you are not living according to your instincts. We are not made for this. We are not made to be inside the whole day and sit still. We are made to be outside. We are made to receive some sunlight and move and use our bodies in a different way that we do today. And that affects also our mental health. And mental health is a big part of a big reason for sick leave, for example. So that's also something that the workplace has to have in mind.
Yeah, I mean, I think mental health is increasing in the awareness of the issue is increasing in these years.
Definitely.
On this point about employers and being indoors at our employers, like very overarchingly, why do you as a medical doctor see that employers should take an interest in their employee health?
I think that would be a very smart investment, both in regards to just show that you care for your employees. That gives more value. As an individual, you feel like, okay, my employer, he really cares about me, and that also attracts talent. So you attract better talent to your company, for example, if that's the word out there, that you do these things. And also, you increase by emphasizing good mental health and good physical health and happy employees. Then you also increase the productivity. So I definitely think that's a smart investment for a workplace to do. Yeah.
It's there is in my research prior to this webinar, I also came across a word called presentism, which is you are present while at work because you are sick. You feel you need to be present, but you're not really working. It also sounds like it's something that you have seen or heard about as a medical doctor.
That you come to work, but you're not really present because you don't feel well. Yeah. Yes, I have noticed this in a way. Like you said, I primarily work with women, of course, and women in midlife are often facing different challenges due to the menopause or perimenopause, for example, and that does, if you're and that can be mental health, more anxiety, more depression, or something like that. And if you're not feeling well mentally, then you can't be as devoted to what you're doing, and you definitely don't do the best work you can do.
Yeah, and that is both, I guess, not very satisfactory to the individual to be there and feel like I'm just not putting in my best. And on the other hand, the tasks that needs to be done is simply not moving, which could perhaps add to some sort of mental workload that you just feel it's piling up.
Exactly. And if we talk about health checks in general, making a screening, a health check screening on a regular basis, I think, as I said in the start, I think it's important for us to get individuals to be more aware and be active in their health journey. And people are very like, we need to see some numbers. We need to see that we are doing something right. And with the health checks, for example, with blood test, regular blood test, and taking blood pressure and things like that, if you can see that in a early age, maybe let's say you're 40 and you get a health check, you get your cholesterol measured, your blood sugar, and you can see that it's maybe it's not high, but it's maybe in the higher range of the normal range. That's a good indicator that you need to change something. And if you see that as an individual, and by now people are very informed and they want to take responsibility, they want to live a long, healthy, and good life, have quality life, not just long life. So if you see some numbers and then you get some instructions or on what you can do to change, nutrition, your movement, what you can, maybe some good advices regarding that, and you make those changes, and then you get a second blood test, for example, and you can see that it's decreased, it's better, then it's like, yes, I'm doing something right. So I think it's a really good way to, I think it's important for people to know their numbers, know their status in not too late. I think around 40 years old would be a good time point to make the first checkup if nothing has been wrong, before. And then you definitely can turn things around and prevent or completely avoid that you get some illnesses in later life.
Yeah, it's of course I guess it's very individual, but what I hear you saying is that when you quantify your health from getting different measurements done, then you can sort of perhaps compete with yourself to then see things improve over time.
Mm-hmm. And that's what we want to do. Like that's our instinct. We want to see some improvement. We want to see that we're doing something right. If you don't see it or you don't feel it, then you're not as excited to do it. So I can see that in my with my clients that many women get a little bit higher cholesterol just in regards to the menopause, just because of decreasing estrogen. We can see the cholesterol are rising, maybe not because they're doing something wrong, they haven't changed anything in their diet or in their lifestyle, but you can see it go higher up. And then they come to us because of maybe different symptoms and get hormone treatment, for example. And then all of a sudden we see that it's falling again. And that's not just because of the hormones, it's because of they feel better, and then they can do the right choices and make the changes that's needed to see that improvement. And in the start phases, when a chronic disease starts to develop, we don't feel it. You can't feel your blood sugar start to climb up bit by bit. You can feel the pulse, but or a little bit higher cholesterol, you don't feel it, so you don't know that there's something maybe off. So I really think you need to see some numbers, and then we are in a better place and better position to make the right choices.
Yeah, it's I guess it's like that, it's you don't feel the gradual oncoming of consequences, but once they are there, the consequences, then you feel them quite significantly.
Mm-hmm. Exactly. And I think like here in Iceland, there's not, the official healthcare system does not provide like regular health checks. If you're 40 and you come to your GP and you want to get some blood test, it can be pretty challenging, and doctors are very reluctant to take those blood tests. But I know in other countries, for Germany, for example, then you have a regular checkup every 3 years after 38 or 40. And I definitely think it could be a good investment for also the official healthcare system as a whole to do that.
You also with that you just answered one of the questions in the comments where Michael is asking, is there a collaboration in Iceland where companies and the public system cooperate regarding offering health checkups to employees? And you said
no, not the public system, but there are some private companies that offer this, but then the company has to pay for it itself.
Yeah. And to everyone out there listening, if there is any questions that you seek an answer to, feel free to share it with us in the chat. We monitor the chat throughout the webinar. We have still 10 minutes left, so please keep them coming if there is anything. It's not often we have a medical doctor that takes time out of her busy schedule to be here and answering questions. So when it comes to quantifying health, what do you think, or what do you suggest to monitor as variables?
As a basic health check, it depends a bit on the individual, and it can be, because you always need to make a risk stratification for each person. But in general, it would be the blood sugar. By now, we normally take long-term blood sugar. So the average for over 3 months, HbA1c,
Yeah.
and then the cholesterol, and we need a full panel of the cholesterol, because it's not just the total cholesterol. We need to see how the panel is lining up, that's maybe. And blood pressure, of course, and I know that you have the VO2 max measurement, and that is actually a good indicator of cardiovascular health or cardiovascular fitness, right? So it can also be used to follow through any improvement. So that can be used as an estimate to see if you're doing any improvements there.
Yeah, and as you just said before, that the improvements is really the best part of it, right? So
yeah, that's what
so
we want to see.
it's like it's a little like Christmas, wow, I got something that I really wanted, a better number, which will also happen to give me a better life, hopefully, at least.
Definitely. But I wanted to also mention a bit, because now I'm in the menopause field, and women in midlife, between 40 and 60, they are a large proportion of the workforce, the menopause is when the bleeding stops, and the ovaries stop producing eggs and hormones. But the years following up to the menopause, it can be 7 to 10 years sometimes, when women start to experience some hormonal changes, and the hormones affect all of our bodies, both mental and physical health. And the perimenopause can be a very challenging time for women in that age. And we see that more women leave work and have shorter or longer sick leaves in that period. So this really is, that's also important for the workforce to emphasize this phase, and we need to talk about it, and to have a workplace that is open to the discussion, and is is willing to take the conversation further, and maybe have some flexibility around the work. Women often sleep very bad at that time, so I have some planned flexible working, ability to work, and you control the local temperature if you're having hot flashes, and if you have a bad night's sleep, that you maybe can come in late the next day. Have a little flexibility around the work for women at that time, and maybe have some occupational health support, maybe paying for menopause expert consultations or something like that. That really gives the women a feeling that, okay, someone is listening to me. I'm really struggling here, and they don't want to leave work at that time. So if the workplace is focused on that, and menopause friendly workplace, that's a new word. And I think that's very important also for the workplace to think about that. It's not only the chronic diseases, but it's also this phase of life.
Yeah, it's I discussed it with my girlfriend prior to you joining us here in the webinar, where it's like why can't women seem to catch a break? It's you firstly you have all your maternity leave that is related to pregnancy, and then many women, more than men, I guess, are super busy with the kids, and then almost as soon as the kids grow up, this onset is right. Whereas
Exactly.
what you told me in our in our discussions previous before coming online is that men is more stable throughout their lifetime, right?
Yeah, but actually, men also go through a decline hormone production, but it happens more like gradually. So the body has better possibility to adapt to that. But for women, when they hit perimenopause, their hormones are like this, fluctuating extremely. For example, estradiol, which is the main female hormone that regulates the energy usage in the brain. So the brain hits an energy crisis, and when that happens, you get a sense of a brain fog. Your brain is not functioning like it did before. So how could you be able to keep up your work like you did before? This really impacts women's sense of how they are doing their work.
Absolutely. And another comment in the comment section from Joanne is it's all about educating the employers. And that comes up back to also what you said in the beginning, that if the word on the street becomes that this employer over here is actually taking good care of both men and women in their workplace, then maybe more talent is bound to seek employment there, and therefore they get the best people.
Yeah, definitely. That I'm sure of. And the education, that's of course our responsibility as a healthcare professionals to get the word out there and have some lectures like we're doing here. And here at Gina Medica, we have been taking lectures around the big companies here in Iceland, and that really is giving some good feedback.
Yeah. We're coming up nearing the end. I just want to ask if Hannah, if there is suggestions from your side as a healthcare professional to personal actions that a person can take in order to improve his or her health. What are a couple of things top of your mind that you would suggest?
Yes, there are these health pillars. Sleep, get good sleep. It's important, and have some good rules around your sleep. So sleep is very important. Stress reduction. Stress is killing us. Our communities, we are like a hamsters in a wheel. We are always powering through, and we often forget to give ourselves some time off for just self-care and just stress relief. It doesn't need to be much, but find something that helps you. It could be just a meditation for 10 minutes, or just a 3 minutes breathing session with yourself before lunchtime or after lunchtime, something like that, just to take your nervous system down a bit. Stress is okay. Stress isn't always bad. We need, cortisol is our vital hormone. It keeps us alive. We need the cortisol. But if it's high all the time, then it starts to have negative effect with more inflammation in the body, and that disposes us for more diseases and etc. So releasing stress, taking some self-care, and we should move. So if you have a sedentary work, if you're sitting by the computer for 8 hours a day, you need to take a break and stand up, move, or either do it before work or during work or after work. Just implement a daily movement in your program, in your routine. And of course, the nutrition, that could be a whole lecture for itself. But we are in this stressful community. We often need some fast food. We need to grab something. We don't have time to prepare some healthy and good nutritious dinner. So we need to think about that. Ultra processed food is very bad for us. Extra sugar and all of that. All of you know most of this, of course. Drink water. Yes. So, but I think in the end, I think it's comes to the stress and the pressure in how our communities are built today, and we
Yeah,
have come a long way from our nature. Both our nature, how we are built, but also just from the nature. We are not out in the nature so much anymore, and that is an important thing as well. Get
that
some
is.
sun in your eyes when you wake up. Get that wakes you up. It keeps your serotonin boosting, and that's our well-being hormone. There's a lot of small things that you can do, put in your daily routine to just improve.
And it's big words about having sunshine every day, coming from you
Coming from
living in
Iceland.
Reykjavik, where sun is possibly going to be limited the next couple of months, going into the
Yeah,
winter time.
it's starting to be very dark in the morning here, actually. Yeah, dark and cold. It was snowing today, actually.
Oh, well,
Oh,
at least snow is white and it
yeah,
lightens up.
exactly.
Hannah, we're out of time. I just want to say thank you so much for joining us. Likewise to every one of you out there watching. Thank you for jumping on this webinar. We will keep monitoring the chat. So we will also be answering the chat over the next coming couple of days. So if anything springs to mind when you watch it or you watch it re-live, if you have not had the chance to watch this live, then do put your questions in the comments. And just as Joanne just did with more vitamin D and morning breath work, cold showers. So everyone there, good ideas coming also. So do also share your own experiences with health checks and also personal actions, what you can do in order to stay as healthy as possible. Thank you to all of you. Thank you, Hannah. Thank you,
Thank you.
viewers. I wish you all a good day. Take care.